Okay, hi again. So I have a little bit more recording for a couple more short PowerPoints that I wanted to get done and get posted. This is prescription writing, and there seems to be an awful lot of objectives for this. Explain the role of dental hygienists in Oregon in relationship to prescription writing. Identify the various parts of a written prescription. Identify common Latin abbreviations used in prescription writing. Develop clinical skills for prescription writing, and discuss how to avoid errors in prescription writing and discuss issues related to writing prescriptions for controlled substances. Prescription's power of dental hygienists in Oregon. A dental hygienist under the supervision of a dentist may prescribe, administer, and dispense fluoride varnish, antimicrobial solutions for mouth rinsing, and other non-systemic antimicrobial agents. So just like you can write a prescription for ClinPro in clinic, you could write a prescription for some other fluoride or antimicrobial solution in a practice. An expanded practice dental hygienist with a practice agreement with a dentist can prescribe prophylactic antibiotics, NSAIDs, such as a prescription stronger, like Advil, like a prescription strength Advil or Etodolac or something like that, local anesthetic, and all applications of fluoride. That is if you have a practice agreement with a dentist. So we have the parts of the prescription. We have what's called the heading. This has the patient's name and address. You might have this up here has a DEA number, but you might have the NPI number also, I suppose, might be there instead. That's the name of the prescriber's information is up there first. So that's why instead of a DEA number, we might put our NPI number. The patient's name and address goes below that. I have seen this in other ways, actually. I think that's what's kind of throwing me off is this PowerPoint I think may need to be updated because I've seen this written in other ways. However, it's important for you to know that the body of the prescription is going to have the medication, how it is being dispensed, the instructions on how to take it. That's the SIG. And then the closing is refills and the signature. So here, this is just describing what we just saw in the previous slide. So you have the heading, which has the dental business, the name of the provider, patient's name, prescriber's information, DEA number or NPI number, the date. The body is going to have the RX or the prescription, the medication name and the amount or the dosage, and then how much is being dispensed, how many tablets or how much liquid, and then the SIG, which is the instructions for use. And then in the closing, you'll have refills. The DAW is dispense as written, and that means no generic substitution. So if a pharmacist or a doctor who's writing a prescription writes DAW, that means that there is no ability to substitute for generic, which could save the patient money. Generic and brand name drugs are also dispensed either or, depending on the doctor and what they want. This kind of highlights the drug schedule. Drugs are, put under the schedule of class 1, class 2. And so, this is just asking, what is the DEA, the Drug Enforcement Agency, DEA, and then the purpose is to track controlled substances. So the DEA are the ones that are supposed to be in charge of ensuring that there's not, a ton of drugs coming into the country, or that there's not, dentists or doctors prescribing far beyond what they should be prescribing or just prescribing inappropriately. So we have the different drug schedules. C1 is the highest. There's the most abuse potential. C2 is high. So, and then you go down to the lowest, cough medicine, anything that contains codeine. Does a dental hygienist have a DEA number? And the answer is no, but we do have an NPI number, and very oftentimes we have to put that if we write a prescription. Dental hygienists can apply for a national provider number, and in fact, I think you all have to. It's a unique 10-digit number issued by the National Plan and Provider enumeration system. An NPI number just replaces a DEA number as an identifier. It just identifies you. It's a unique number to you as a healthcare provider. Transition to an NPI is mandated by HIPAA, and getting an NPI is really, really easy. And I think, and here's a link to doing that, but I think you all might do it in maybe one of your other classes. This is just the information that they want. And then the tax code that we use as dental hygienists is 124Q, 4 zeros, 450, sorry, and an X. Here are common Latin abbreviations. You are, okay, so there, I don't know how to, I don't want you to think that you have to memorize each one of these, because you don't have to memorize all of them. However, I do, and I should have highlighted the ones I want you to memorize, because there are some of this on quizzes and exams that I've already seen written from years past. So the ones that you need to really be aware of: BID twice a day, AM, PM, morning, evening, capsules. Some of these are very self-explanatory. DIS, dispense, PRN as needed. You need to know PRN as needed. Q, D means every day. H means hour. And then I want you to know how many times a day. So QID, 4 times a day. Where's the other one? TID, 3 times a day. BID, twice a day. BID. So I want you to know the how many times a day. PO, by mouth. So there's the ones that you don't have to know. Some of these are just, tablet. You would know TAB is short for tablet. The right eye, left eye, drops. You don't need to know those. RX just means to take it as prescribed. Stat, take it at once. That's, kind of a common medical term. This Q8H, like every 8 hours. I'm not going to test you on that, but I do want you to know the BID, QID, TID. So twice a day, 3 times a day, 4 times a day, and then the PRN, and then the PO, by mouth. So there's a few there that I would like you to be familiar with. Here is how fluoride tablets might be written up. You have the provider's information, the patient's information. Sodium fluoride, 1.1 milligram, 120 tablets. Chew and dissolve 1 tablet in the mouth, then swallow once per day, preferably before bedtime, after brushing. They're putting stat, so you do it right away, and then finished for, I feel like something's missing there. That just seems wrong. Stat would be to start it right away, but I don't know what it means by then finished for. They've just left that. That's not printed out very well. ADA recommends supplemental fluoride dosage, and this is the schedule. So if they are 6 months to 3 years of age, the fluoride in their drinking water is less than 0.03 parts per million, then they would be prescribed 0.25 milligrams of fluoride in a fluoride tab or a liquid dropper. If they're 3 to 6, a 0.5 milligram, and then if they're 6 to 16, a milligram. And that is, they need to know what their fluoride in their drinking water is, and so that you can give them the appropriate dosage. Here's another prescription for fluoride. Here's one for chlorhexidine. Dispense 3 16-ounce bottles. The instructions is to swish with a 1/2 ounce for 30 seconds twice a day. Here's amoxicillin. This is an antibiotic premedication. So they do not have an allergy to penicillin. So they're going to take amoxicillin. Each tablet of amoxicillin is 500 milligrams, and they're going to take 4. So they're going to take 4 tabs by mouth 1 hour prior to the dental visit, that equals 2 grams of amoxicillin. And that's the prescription, 2 grams of amoxicillin. And they just do it the one time before the dental visit. If they're doing clindamycin, they come in 150 milligram tablets. They're going to take 4 tabs for a total of 600 milligrams 1 hour prior to treatment. And so this is just an opportunity for you to practice. Caleb is a 6-year-old who lives on a farm with well water, which does not contain any fluoride. What dose of fluoride, if any, should he receive? Write his prescription out. So he's 6 years old. So you would just go back up here to you would go for a milligram. Since there's no fluoride, you would have 1 milligram. And if you're going to write him out a prescription for 1.1 milligrams of sodium fluoride, it comes in, that would be a 0.5 milligram. So he would need 2.2. You double it, obviously. And it would be a tablet to, take by mouth one time a day, or it would be a swish or something like that. If it's a rinse, or if it's an ingested tablet, which is what the supplements are. Those are ingested tablets. Really the pediatrician is typically the one who's going to do that anyways. I've never written a prescription for supplemental fluoride. Here's another case. Robert is 55-year-old male who's having a tooth extracted, medical history. He has a prosthetic heart valve. So this is a big red flag for pre-medication. He's got hypertension, atrial fibrillation, and he has got an allergy to penicillin. It gives him hives. Prescription, he's taking lisinopril, which is a high blood pressure medication, and Prilosec over the counter, which is for heartburn or indigestion. And he takes those by mouth daily. Now, so he's allergic, he gets hives when he takes penicillin, so he's not going to be given amoxicillin. So he's going to be either given a cephalosporin, or he's going to be given a clindamycin. Likely, I think clindamycin is more common. And so you can go back and see the 600 milligram, 4 tabs of 150 milligrams 1 hour prior to his appointment. Some questions. Is Robert a candidate for prophylactic antibiotic? Yes or no? What antibiotic could be prescribed for Robert? Write the prescription out. So I sort of just talked you through it, but go back and think about those, and we can talk about those in class too. Reduce in medication errors. The prescriptions should be written clearly. Do not abbreviate words that are not universal abbreviations. So you don't make up your own abbreviations. Abbreviations are helpful in saving time, but if you are unsure about how to abbreviate it, just write out the whole word. Write prescriptions in ink and print clearly, or use an electronic tab. And then reducing medication errors continued. Enter the number of refills on the prescription so that they can't write it in. Like if you only want them to have 1 or 2 refills, then that's all they should have. And then prescription should state the dose, frequency of administration, and the age of the patient. Communicate with the patient on how to take the medication when you are handing them the prescription. And the pharmacist should do this as well, but you should do it with your own patient. And that is it for that. Now, what I do want to do here is also quickly add to that the slides for the oral contraceptive and bisphosphonates that I kept saying I was going to get to, but I have yet to have done that. So I'm going to pull that up here very quickly, and we're going to go over those as well. So this sort of goes with the endocrine system. All of this information was pulled from the chapter of your pharmacy book that's the endocrine system. Let's see if I can make this bigger. Okay, so we have a couple different medications here. We have adrenal steroids. It's part of the adrenal gland called the adrenal medulla, and it produces and secretes epinephrine and norepinephrine, which stimulate your sympathetic nervous system. The adrenal cortex releases steroid hormones into the circulatory system, or corticosteroids, and the synthetic glucocorticoids are used primarily as anti-inflammatory agents used in asthma, rheumatoid arthritis, and lupus. Also as immunosuppressant drugs used for organ transplant patients. Corticosteroids may be used to treat Addison's disease, which is adrenal insufficiency, oral ulcerative inflammatory lesions such as lichen planus, burning tongue, and aphthous stomatitis. Those could also be used for corticosteroids, could be used for those as well. Systemic glucocorticosteroid drugs, there are short-acting ones, hydrocortisone, cortisol, Cortef is the brand, intermediate-acting, methylprednisolone or Medrol or prednisolone. These medications, for instance, many doctors utilized these and the dexamethasone or Decadron. These medications were used quite a bit during the high time, the beginning of COVID, when people were going into just a total systemic inflammatory response, where their systems, their whole bodies were just like had crazy amounts of inflammation. Doctors were utilizing dexamethasone and prednisolone or methylprednisolone with quite good success. Dental hygiene implications. Long-term use of systemic glucocorticosteroids can turn off natural production of hormones by the adrenal cortex. A patient can go into adrenal crisis, acute adrenocortical insufficiency. A stressful event could trigger this. This would be very rare in dentistry, but I suppose it's possible. Consult the physician prior to a dental procedure if the patient seems to be at risk for an adrenal crisis, or if they have been on long-term systemic glucocorticosteroids. If they have some kind of a condition where their immune system is trying to be suppressed, or they're using it for some kind of inflammation, likely like some kind of an autoimmune condition or an organ transplant or something. If their doctor thinks they're at high risk for adrenal crisis, and they're fearful or have a lot of anxiety, it could be an issue. Other than that, it's not very common that would happen. Okay, sex hormones, just going to talk a little bit about what those are. We have estrogens. With estrogens, we can see gingival inflammation. That's why young teen girls can have like hormone-induced, or pregnant women can have hormone-induced gingivitis. Also interacts with several medications such as warfarin, benzodiazepines, antibiotics, and phenytoin. Progestins are another sex hormone. We also have hormone replacement therapies, which are generally speaking estrogen plus progesterone. Oral contraceptives are also sex hormone products, and they're often now formulated with much less estrogen. So we don't oftentimes see the gingival reactions that we maybe would have at one time. There are a lot of products. You do not need to memorize them because there are so many of them. So this is more just sort of informational. I'm not even sure that much of this is going to be on any kind of a test for you, but you still need to cover this information. This, however, if I highlighted it, you will need to probably know this for a test. Oral contraceptive broad spectrum antibiotics interact with oral contraceptives and decrease the effectiveness of the oral contraceptive. Certain anti-retroviral and HIV medications, such as ephedrine, and then certain anti-seizure medications, such as carbamazepine, I'm not going to read all these, levonorgestrel, oral norethylnidrone. I would have failed so hard in pharmacy. I mean, I don't know how they memorize all these names, but anyways, St. John's wort. So broad spectrum antibiotics can, or oral contraceptives can interact with these medications as well. female patients should be advised to use an alternative method of birth control while on certain antibiotics. Smokers who take estrogen alone or with progesterones have an increased risk of stroke. So that is a great place to introduce a smoking cessation counseling. And then women taking oral contraceptives may show signs of gingival inflammation, including bleeding upon probing. It's not as common as it used to be. But this slide has some important information, especially this highlighted piece and then down here. So that could be on a test. Bisphosphonates for osteoporosis. Bisphosphonates inhibit bone resorption by decreasing the action of osteoclasts. You know, you have osteoblasts that build up bone, osteoclasts tear it down. Well, they inhibit the body's tearing down the bone piece. So osteonecrosis of the jaw, that is basically necrosis being death, or so death of the jawbone. It may cause severe, extensive, irreversible damage. More frequently, you will see this in the mandible as opposed to the maxilla. The risk of developing osteonecrosis of the jaw is far, far, far higher in individuals who use a bisphosphonate through IV. So not so much oral pill, but more IV use. And that is going to be more commonly seen with people who have a history of cancer. But it could also be someone with osteoporosis that are doing like a monthly IV injection. Indications for use for bisphosphonates: osteoporosis, hypercalcemia with metastatic cancer. It helps to pull the calcium out of the blood, Paget's disease, or chronic renal disease if patients are on dialysis. Bisphosphonates that you should be familiar with: alendronate or Fosamax, that is oral. Rhizendronate or Actinol, that is also oral. And then we have Boniva, which can be oral or IV. So that's going to be the drug that they might be more susceptible to the osteonecrosis of the jaw, ibandronate. And then we have clodronate or bone phos, which is IV, and this can be used for cancer patients, indicated for hypercalcemia. And the last slide here, dental hygienist considerations. Dental risk factors for oral necrosis of the jaw: periodontal surgery, extractions, dental implants, ill-fitting dentures. All of these dental procedures, if a patient has been on an IV bisphosphonate, they are at a much higher risk for ONJ. So patient education is top priority. If a patient is going to have some dental work, like one of these things up here, and they're on an IV bisphosphonate, they need to understand the risks. So before they start bisphosphonate therapy, they need to have had these procedures done. Discuss patients' dental needs with the physician. All dental work should be done prior to patients starting medication. Priority placed in maintaining oral health to avoid problems in the future. So I know that was fast, but I didn't want to make another super long recording for you. So I've pretty much told you during this recording what I want you to know for quizzes. Anything that's highlighted, a few bits of the suffixes for Latin, and basically knowing the parts of a prescription. You need to know what's in the body, what is the sig, what you need to know those pieces. You might have a test question asking about the different parts of a prescription, and then those couple Latin abbreviations that I wanted you to know. And then what's highlighted here, and the dental hygiene considerations is also something that you should know as well. So that is all for now. Take care, you guys.